Hello, my name is Dr. Neil Baum, and I would like to share a true story with you regarding the care I provided to a Jehovah's Witness patient. The story begins that I'm providing care for a middle-aged man and I'm consenting him for a radical nephrectomy. I met with the patient and his son says to me, "We are both Jehovah's Witness, and I don't want my father to receive any blood products." The father agreed that that was his wish as well, and the conversation was documented in the chart. It was the night before surgery, and I met with the patient, and he was alone in his hospital room, and the patient admits to me, he says, "I'm not quite as religious as my son. If I need the blood, please give it to me and don't tell my son about the transfusion." That discussion was also documented in the chart, and I typed the patient for 2 units of packed cells. Patient had the surgery, had significant blood loss, developed some symptoms of hypovolemia in the recovery room, and he received 2 units of packed cells. No family members were allowed in the recovery room while he was receiving the blood. And I even instructed the nurses to change the IV tubing so there would be no telltale signs that he had received 2 transfusions. I then met with the son in the family lounge. And the son says to me, looking me straight in the eye, he says, "Did my father receive any transfusion?" Well, I was like a deer with looking into the headlights. It really caught me off guard. And I said to the son, "Why do you ask?" And the son said, "Someone from the blood bank had come to the family lounge during surgery and asked if anyone in the family would consider donating blood as their father was going to receive blood." The mistake I had made was I forgot to inform the blood bank that the patient was going to receive transfusions and not to ask anyone from the family to donate blood. So I was confronted with a decision on the spot. Do I tell the truth? Do I tell the son about the previous night's discussion with his father when we had a one-on-one discussion? That would certainly rupture rapport between the father and the son. It would also change the trust that the patient had with me. Or do I lie to protect the patient? I had to make a decision very, very quickly. So what would you do? My response was to the patient and protect his wishes and preserve his relationship with his son. What I said was, there must have been a mistake, as your father did not receive any blood. The Hippocratic Oath, the first rule is do no harm. And my opinion was that there's sometimes more than clinical harm, but also psychological harm that we can do to our patients. If I had told the truth about the transfusion, I would have harmed the patient. I lied to protect my patient. So what lessons did I learn? First of all, I learned that Jehovah's Witnesses need to express their personal preferences of treatment, and that any discussion that I would have with a patient should be without the presence of other family members or other members of their faith. And having taken care of several Jehovah's Witnesses, I learned my lesson regarding this patient where I had to tell a lie to protect his relationship with his son. So what's the bottom line? Bottom line, I ask you, what would you have done if you were in my position in that surgical lounge when the son confronted you about his father receiving blood? And I ask you, do you have any other similar stories where fast thinking is required? If you do, please share them with me and with our colleagues. I hope you found this presentation useful in your interaction with your patients who are of the Jehovah's Witness faith. If you have any questions, please let me hear from you with the email address provided on the last slide. Thank you.